I've been practicing physical therapy for a little over 8 years. I've been a certified strength and conditioning specialist for a little over 10 years. Most of my background professionally was back in Philadelphia. Spent about 5 years at a sports clinic there, mostly professional or high level athletes. I felt like it was important, like you kind of said before about your experience with ARP, is, taking that high quality of care and giving it to the masses. So I've always felt like more people deserve to be treated like a high level professional athlete. So that's kind of been my mission and my mantra, the last, I'd say, 3 to 5 years, has been, where is my avenue to deliver that? And I found that the best way to do it was to do it on my own. So that's what I did. And that's how I met representatives from ARP to try to take that next level step. So I think the results have spoken to themselves. So I'm happy to share my experience with the unit.
How long have you integrated the PRS into your practice?
Yeah, I've been using it probably since, I want to say, around January or so, January, February, last 5 months, 5, 6 months. So I try to, just like any other piece of equipment I have, I use it when I need it. It's a common question is, how often do you use this or that? It's, when I need it. It's like just like any good, I guess, carpenter, it's an additional tool in my toolbox. So I will say this is probably one of the most versatile tools in my toolbox. So I use it quite often.
If you could give us a few examples of some of the go-tos when you have a client or patient come in and you go, okay, yep, no brainer, I'm using the PRS.
Honestly, it's good for anyone that needs to move, so it's the administration of it is kind of really profound. So I found really good benefits with it acutely. I would say, just anecdotally, neck pain, your typical like upper cross syndrome type of, tightness or spasticity in the upper quarter. Use it on people with, whiplash type of acute injuries where you need to get them moving and you need to find an entry point into their activation or strengthening. And that window can take a long time to find, if they're in pain. So sometimes when I want to move someone or have them start moving, I slap the unit on and it kind of starts moving them for them, a little bit, if you've experienced it before. So it's a nice sensation. It's different from a TENS unit, which I love. And the best part about it is it promotes movement. I'm a big believer in active problems needing active solutions. Unfortunately, not everybody is ready for an active treatment just yet. So it takes a passive modality like a stim unit, and it allows an active treatment for it. So the uses are very, very wide. So that's been my point of it, though, is when I can't overload somebody or get somebody resisted, that's been my really, really good entry point.
Just off the top of your head, I'd love to hear a story of the best outcome where the patient, you gave them their life back.
Early on, I used it more consistently during the acute to subacute phase. I had a CrossFitter, very, very high level, like nationally ranked CrossFitter, who was dealing with a biceps tendon tear in their shoulder. And it was bad. It was a bad one. And they knew how bad it was because they had a previous biceps tendon tear on their opposite side 3-4 years ago that required surgery. So it was kind of one of those things, like they knew the road, they knew what needed to be done. They had gotten back to the high level competition, but it was kind of like, I'm in my 40s now, it's this, I'm not trying to go under the knife every 3 to 4 years here. So we started using it very early on and pretty consistently. And then when ready, we kind of transitioned off, but would intermittently use it depending the phase of training they were in. And that was as early as I got it. It was one of the first clients I used it on. So here we are, fast forward, I'd say maybe 4.5 months later, just recently, hit up a bench press PR with, if you have anybody who's CrossFitting, and bench press is probably one of the more aggravating activities, especially the overhead stuff. But the heavy bench press was for him a really, really irritating activity. So for him, a high level competitive CrossFitting athlete, to PR a lifetime in his 40s with a known tendon tear, for me, really, really stuck out. It showed its benefits.
What was his reaction? I mean, he went through surgery on one shoulder and then utilizing this technology and the PRS on the other.
I think from day one, he was really loving it, especially just like I would do a lot of pre-test, post-test style treatment in my sessions. So, check your range of motion, apply a treatment, reassess, see where we're at. So to get those in-session improvements early on is kind of like, I don't love selling myself or a product, but if the product can sell itself and it makes me look good, then that's all I need to do. So I think those early on and immediate gains in session gave him the confidence to buy into it and trust the process. And I think that led to his consistent gains throughout. So I think he was very, very surprised. And we had hit other benchmarks kind of through the process, but I think that one and it being more recent really stuck out in my head.
How did your process work going through utilizing this for different modality for different issues and injuries?
For me, I think to keep it simple was really just when, I had a movement pattern that was dysfunctional, a forward step down or looking over the right shoulder. All you really need to do is whatever active movement you would use to treat that was apply the unit to synergistic muscle groups. And that's kind of how I would do it. I got, just again, those movements kind of stuck out in my mind because I had a client early on that I would use that on. That's a little trick I would use is forward step down, patellar tendon type of pain, have them do a forward step kind of isometric, slap the ARPneuro on there, and it really kind of gives them the feedback of like, wow, now I'm not really feeling the patellar tendon pain. I'm feeling this blast of activation into this quadricep group. So, which is what you're trying to do with that step down anyway. You're trying to trick them into doing the painful movement. The ARP just kind of really gives it that real big extra nudge into a better direction. So that was my early way of doing it too, because it was presented to me in a similar fashion. Like, wow, it's so widely used. How can I use it? And I think for me in my practice, like I said, I'm trying to give active treatment. So that's how I implemented it. So that would be my advice is take a simple movement pattern and apply it and pre-test, post-test, and assess for subjective and objective improvements.